I was at this meeting in 2019 in Arizona, and I saw the Accuro on a booth just like this, and I looked at it and said, well, that's really interesting. I like to try new stuff. So she sent me a sample, and then I started using it, and I was like, wow, this is really great.
I was basically looking for something that I could carry in my hand. I didn't have to drag the whole ultrasound, so I needed something that I can do a quick scan and then get on and finish the epidural.
I'm always looking for ways to optimize my care for my patients, and I find that the technology that Accuro provides would allow me to facilitate a more effective epidural and decrease my complication rate, which optimizes my anesthetic and also the patient experience.
Some of the patients were, well, I don't want to get an epidural again because it was problematic. And I said, we have a device, and it would decrease the time and the difficulty and the anxiety for the patient of how long it took me to either place an epidural or a spinal.
We have some BMIs of 60 patients and plus. That's when I use it the most, when I'm trying to find center and I just can't find it. So then I go to the ultrasound, and it's a very quick and easy way to figure out at least where center is and give me some idea of how far it's going to be to the epidural space.
The way it impacts the patient is when you tell them that you're going to use an adjunct like an ultrasound before you do the block, the patients really feel like you're taking an extra step to increase the safety and the comfort of doing the procedure.
Unlike a lot of other ultrasound techniques, neuraxial ultrasound is a relatively easy technique to learn.
It was super easy to use, super fast to learn how to use, and we found the same with our newer providers as well as our students and our residents.
Here's the important thing with the Accuro to learn, is you use it 5 or 10 times, you're gonna be fine.
I really like the split screen because it allows the learners and myself to see the reconstituted 3D image and also at the exact same time see a real-time, unfiltered ultrasound image. And so you're learning as well as getting the kind of AI information that Accuro provides.
I think it has saved me time. It streamlines it, makes it easier in those patients when you have a low threshold to just say, okay, I'm going to start with the ultrasound from the beginning. It saves you a lot of time.
What I like particularly about Accuro compared to other ultrasound probes is it has the ability to mark the space with a plastic device that slides off the probe and then indents the skin.
It was so easy to use. I'm somebody who grew up and learned before ultrasound was widely available, and this made ultrasound very accessible and very useful. We found that even providers who were having difficulty placing epidurals got much better and faster using this device.
So I had a patient, she had a lot of instrumentation in her back from a previous auto accident. What happened is over time she developed some pain along her scar line, and it's interesting, her scar was not even in the midline when you looked at her back, because she had instrumentation from the thoracic to the middle lumbar area. And I actually was able to scan her in her doctor's office prior to her being in labor, which was really helpful. And I was able to scan and I saw a space. There were no promises, but she came into labor and I was able to use the Accuro and find the space, and she had a safe and nice laboring experience because I was able to use the Accuro to get the epidural in place.
I would definitely recommend it. We use it quite frequently. We tried it at the convention, took it home with us, and then we've used it ever since in our practice.
I do recommend Accuro to my peers. I think anything that we can do to optimize our epidural analgesia or anesthetic or spinal placement is essential in order to increase patient safety and patient satisfaction.
I've been doing OB anesthesia for a long time. And if this can help me, I guarantee it can help you. And it certainly helps me in many, many situations.